Hi, everybody. Welcome to our webinar, our last mental health webinar of this series, Policy Strategies for Reducing Behavioral Health Disparities. My name is Carolina Valle, and I'm the Policy Manager for the California Pan-Ethnic Health Network. Thank you all so much for joining this webinar today. I'm really excited about our webinar, Policy Strategies for Reducing Behavioral Health Disparities. And our amazing speaker, Mandy Taylor, who is the Outreach and Advocacy Coordinator at the LGBTQ Health and Human Services Network. Before I pass it over to Mandy, I'd like to first just give a brief overview of why it's so important to engage in policy advocacy to support communities of color and their mental health. As many of you know, the California Pan-Ethnic Health Network is a statewide multicultural health policy advocacy organization that works to address disparities in communities of color, including behavioral health disparities. We know that the demographics and needs of communities of color vary by county, and the strategies to support them also vary. These are impacted by the political landscape, funding streams, and decision makers. Next slide. And so CPEN's partners across California have a long-standing history of local advocacy and engagement in mental health. With the recognition that public mental health services is fundamentally a local system, CPEN has enhanced its advocacy and engagement at the local level alongside our partners. Local advocacy is so important because not only are the needs particular to regions, but successful statewide policy is often shaped by county policies. And so here are just a few examples of our local advocacy efforts from the past year. On the top right-hand corner, you will see that along with our partners, we worked with county policymakers and advocates to improve referral pathways into county mental health services for My Health LA patients. In Orange County, you'll see on the bottom right-hand corner, in Orange County, Oakland, Fresno, and Los Angeles, we held regional listening sessions this past summer across the state to better understand the local needs, what's working, what's not working, and where do we need to go in mental health policy. And upcoming in Stockton, we are partnering with local advocates to organize the Stockton Reducing Disparities public hearing, which will be happening next Tuesday, December 11th. And this was inspired by CPEN's CRDP conference in Los Angeles. So we hope that all of you can make this to make it to the Stockton Reducing Disparities public hearing event on December 11th. It's a true culmination and community-driven effort. Please reach out if you have any partners that are interested in attending this local event. And then next slide. One of our big local efforts in mental health is our immigrant mental health work. This past year, our partners have told us that access to local mental health services for immigrant communities is particularly challenging. And so to support their work, we undertook efforts to understand how communities are providing services to local communities. And we will publish our findings in January 2019, so please be on the lookout. But as a preview for all of you who are interested in doing local mental health advocacy, we did find that counties are fearful to take a public leadership role on funding and provision of mental health services to undocumented immigrants in particular. Providers need more training on how immigration status impacts mental health and well-being, and county mental health departments should partner more with local legal aid organizations, CBOs, and county safety net programs to facilitate referrals. These findings are going to inform our local and statewide advocacy strategy, and so for all of you who are interested, please reach out. All right, so that's just a summary of some of our local mental health policy advocacy efforts. I'd like to pass the mic to our phenomenal partner, Mandy Taylor from the LGBTQ Health and Human Services Network, who will educate us about how you can all engage in county-level mental health advocacy.
Thank you so much. My name is Mandy Taylor. I use she, her, hers pronouns, and I'm from the California LGBTQ Health and Human Services Network, a program of Health Access California. And I am a part of the Out for Mental Health team. You can go ahead and go to the next slide, please. Thank you. The Out for Mental Health project is a collaborative project between the network and NorCal Mental Health America, our partners in this, and we're funded through Prop 63 funds. Prop 63 is that 1% millionaire tax that folks are probably familiar with and we'll be talking about a little bit this morning. Go ahead and go to the next slide. We specifically are doing work for queer and trans mental health advocacy in California. And as Carolina said, this is really just fundamentally shaped at the local level. And so we're engaging both at the state level and within local counties. We do this because, like many marginalized communities, the queer and trans community has higher rates of mental health issues as a result of living in communities that often feel hostile to who we are as beings. And in addition to that, we see even higher rates among our communities of color and our trans folks because of those intersecting identities and experiencing intersecting oppressions. Go ahead and do the next slide. I would like to invite you, as we're going through this webinar, please feel free to type into your question box if any questions come up, and Carolina will convey those questions to me. We will also have a question and answer period at the end if anything doesn't get answered. And I would also like to invite you that my email will be at the end of this presentation. If you have any questions that are specific to your county or area, any way that we can provide technical assistance, please do feel free to reach out, and we're happy to help with that. And so I want to start with what our rights are to affirming care. And I want to clarify too that this presentation or information was designed for using a queer and trans lens looking at it. And I also want to make sure that folks on the phone that are working predominantly with communities of color and other marginalized communities or communities that are identified as priority populations, these rights also apply to you, particularly when we're talking about the local control funding formula and the Mental Health Services Act. So the local control funding formula is a state law, and it mandates that each school district have a plan for how they're going to engage their priority populations within their school district. And that includes parent and community involvement. This statute requires that communities are involved. It requires that they plan specifically for outreach to communities of color, to LGBTQ communities, to pregnant and parenting youth, to youth in low-income communities, those young people that we know are at particularly high risk of experiencing mental health concerns and other high-risk behaviors. So particularly the state prioritizes equity, culture and climate, family, community, and professional development. I also want to point out that the local control funding formula, like the title says, includes funding. And so we've actually seen a lot of communities at the local level engage with their school districts in being a part of the local control funding formula through the LCAP. That's the plan that each district does. And going to the school district and saying, please write us into your LCAP that we want to provide education to your staff folks, and we want to, you can go ahead and back up one. Thank you. We want to provide training to your staff folks, and we want to provide support to your community. So that's a really great way to advocate. Then the other right to affirming care through the Mental Health Services Act, so that's that Prop 63 that I was talking about, is the Mental Health Services Act is very clear that cultural competence is a key component of that act, and that any mental health services that are provided within California need to be culturally competent. And not just vaguely culturally competent, or, oh yes, if you're a person of color, if you're an LGBTQ person, if you're a disabled person, you're welcome here, but actually taking an active role in reaching out to those communities and providing culturally specific services. And then lastly, through the Affordable Care Act, federal protection is Section 1557, and that is specific to sexual and gender minorities. And please reach out if you'd like more information on the federal level. Now you can go ahead and switch it for me. Thank you. So in terms of the local level decision makers, the places that you can really engage with folks who are making decisions about mental health care in your community are the Mental Health Services Act Steering Committee. Any county that is receiving MHSA funding does have to have a steering committee, and that steering committee makes recommendations for how that money is spent and how those programs are overseen and implemented. They report to your mental or behavioral health board representatives. The reason I say mental or behavioral health is because there are some counties that are very large, like Los Angeles County. They have specifically a mental health department. And then there are other counties that are smaller, such as Kern County, that they have a behavioral health or a behavioral health department that supports folks with both mental health and substance use services. So you just want to take a look at how your county is configured, but they will have a board either way. You just want to take a look and see what the name of that's going to be. The next one is the Drug and Alcohol Advisory Board. And the reason that I put this in here is because oftentimes folks with mental health issues are using substances as a way to self-cope and self-medicate. And so the Drug and Alcohol Advisory Board is also a really good place to do advocacy and let them know how they can incorporate trauma-informed care, how they can incorporate harm reduction and other mental health components within their substance use treatment models. And then the local school board also makes a lot of decisions for it, particularly for our student mental health. The local school boards are required to follow California law, and they can also go above and beyond that. So your local school district has the ability to place extra protections and extra support services for our underrepresented and undersupported youth. So they're also a great place to go for advocacy for decision makers. Then next would be your behavioral health department director. I certainly don't suggest starting at the behavioral health director department. It seems to be a smoother process if you start with the committees and the boards. And sometimes, particularly if you're maybe in a community that is particularly conservative or is not particularly affirming for folks of color and LGBT folks, then your director is the one who's ultimately making those decisions based on the committees and boards' recommendations. And then your behavioral health department director is who makes the recommendations to your board of supervisors. And your board of supervisors is who authorizes budgets. Your board of supervisors is who says what programs are going to get funded based on your behavioral health or mental health department director's recommendations. Your behavioral health department director, though, does have the ability to initiate policy when it doesn't involve budget. So they're great. If you're not asking for extra money for a program, what you're asking for is for the county to implement a policy to be more supportive, then that's a good person to go to. And Board of Supervisors is also who approves any plans for mental health, any funding for mental health that then needs to be kicked up to the state level for approval. And you can go ahead and go to the next slide. Thank you. So the way the public mental health system works can be a bit challenging, particularly for folks who generally work at the state level. And the reason for that is, as Carolina said, most of that does not take place on the state level. Most of it takes place at the county level. The state in the 90s did what they called realignment. And so if you ever hear somebody say like realignment dollars, that's what they're talking about. They realigned the funds in 1991 and then again in 2011 to the county level. So although the state collects funds and does make some policy that is instituted at a state level, the counties are actually who decides how to spend those funds and how to implement that policy. They're in many ways their own little fiefdom with oversight, right, from the state. So the state or the county is who decides what the committees look like, what they're going to approve for budgets, whether policies are going to pass. School boards also are making a lot of decisions, and they're receiving funding from both federal and state Medicaid and Medi-Cal funds. And the reason I specifically point out what the funding is when I'm talking about advocacy is because often if you can find out where somebody is funded from, you can find out, okay, well, what are the policies and protections associated with that funding? So in a way of saying, well, school board, if you want to receive funding through the local control funding formula, then that means you have to follow the state law for inclusion and support for our students. Or saying if you're receiving Medi-Cal funding, then you need to make sure that you're following Section 1557 protections. If you're receiving MHSA dollars, then you need to tell me how are you being culturally competent? How are you making sure that you're meeting the requirements of the Mental Health Services Act for actively supporting our communities, actively affirming our communities, and actively providing culturally relevant and culturally supportive services. Now, some counties also receive SAMHSA block grant money. That's the Substance Abuse and Mental Health Services Act. So SAMHSA is the federal program that provides substance use and mental health services. Now, prior to the Mental Health Services Act passing, many counties were entirely reliant on Medicaid, Medi-Cal funds and SAMHSA funds for their mental health services. And now with Mental Health Services Act dollars, there's actually quite a bit more happening. If you're ever working in your county and your county starts talking about things like, oh, this is an innovation program or this might be an innovation program, that's because 5% of MHSA dollars are set aside for innovation. If you are, say, if you're hearing things like PEI, that's prevention and early intervention funding, and I believe it's 15%, that might be slightly different, but I think it's a minimum of 15% in each county. It's for prevention and early intervention. We have lots of queer and trans community organizations that are using that funding, the PEI funding, to fund centers, to fund outreach to at-risk youth. A lot of the programs that are for young boys of color are through PEI dollars. A lot of things to support the trans community are through PEI dollars. So that's something to take a look at and make sure that they're covering that. I would also urge you to take a look at what's happening with Prop 64 in your county, because the counties will start receiving Prop 64 dollars. That's the cannabis legalization funds that just recently passed. And we're expecting that to look a little bit like the Mental Health Services Act when it passed, it was really kind of a small amount at the beginning as it was being implemented and ramped up. And then now it's a large portion of each county's budget. So we're expecting Prop 64 to look like that. And it's important to note that 60% of the revenues from Prop 64 need to be allocated to youth prevention and early intervention. And we've recommended that at the state level and the county level that be implemented, particularly for communities who have been most impacted by the war on drugs. So in particular, we think in low-income communities, particularly low-income communities of color, that those funds be prioritized because those communities have been impacted the most negatively by the war on drugs, and the way that that's been enacted as systemic violence against those communities. So keep an eye on what's happening in your county for Prop 64. You can hear more about it at the Drug and Alcohol Advisory Board in your county. And then you as mental health advocates are really great folks to make that connection for your county. You may already have folks in the county who've made the connection between substance use and mental health, and prevention and early intervention means providing trauma-informed care and means providing supportive harm reduction models. And they may not. So you can be that voice in the room that makes those connections for the decision makers who might not be on the ground and in the streets and know what it really looks like in our communities. And you can go ahead and go to the next slide. Great. So the state system passes legislation. So things like Prop 63 and Prop 64 were put on the ballot and passed by the voters. There's also legislation that passes through that makes decisions about how that legislation is implemented, or how we want to see the different departments run. There are a couple of oversight bodies as well that are established for mental health. Now, back pre-1991, pre-realignment, we had a Department of Mental Health. We no longer have a Department of Mental Health in the state of California. That has been completely realigned and kind of broken up into pieces within state offices. So in particular, we have the Mental Health Services Oversight and Accountability Commission. Now, they oversee any of the Prop 63 money, the MHSA, Mental Health Services Act funds. That's who oversees that innovation, prevention, and early intervention, and community supports. So they act on the state level to help oversee those things. And then the Department of Health and Human Services, particularly through the Department of Healthcare Services, oversees how the Medi-Cal and Medicaid funds are spent for mental health, and they also oversee much more so than the MHSOC, the community support for the MHSA, because that's oftentimes folded into the Medi-Cal and Medicaid. The Board of Education also makes decisions as it impacts our schools, and it looks like I left off the California Behavioral Health Planning Council, and that's probably because it's in my next slide, but let's stay on this one. So it's important to know who's making these regulations and policies and who's implementing them. What I will tell you is that it's very challenging. In particular, the Department of Healthcare Services is challenging to do advocacy through, only because it's a very large agency that oversees all of the components of how Medi-Cal services, Medicaid services are implemented in California, and mental health is only a small component of that. So it can feel very unwieldy or very challenging to engage with that system. if you do need to engage with that system, I would definitely suggest recruiting folks that work at the state level through CPEN, through the network, through NorCal MHA, to help you navigate that system, because it can be unwieldy. And then through legislation, there's a lot of legislators that are very supportive of mental health. And then in terms of the executive branch and the governor, we will see what our new governor does. So we don't have a clear idea yet where he's headed in terms of mental health. So I'm sure CPEN will keep you up to date on that. The MHSOAC has open meetings every month. There is public comment at those meetings that you are welcome to attend and be a part of. The state is who collects the MHSA, the Prop 63 1% on millionaire tax, and distributes it to counties. They're also who provides Medi-Cal funding and brings through those matching Medicaid dollars from the federal level. They distribute the SAMHSA grants, the Substance Abuse and Mental Health Services block grants. They provide the realignment dollars through things like your driver's license registration fees. And they also distribute Medi-Cal waiver funding. So that's another thing to take a look at. So the state is really playing a more of an oversight role than an implementation role in most cases with mental health. There are some exceptions to that. My program is one of those exceptions. So myself and several other marginalized communities have advocacy funds through the state level, where we've been allocated funding to the Mental Health Services Oversight and Accountability Commission to provide advocacy to particular populations at the state and local level. So that's also one way in which the state oversees. The state also set aside some money in the budget. The governor set aside some money in the budget for a suicide prevention plan. That's happening at the state level. So there are smaller pieces or projects that happen at the state level, but the majority of it just goes through the state to the counties. You can go ahead and go to the next level. Great. And I do want to, again, just encourage people, if you have any questions, please feel free to type them in, and then we'll take questions at the end as well. Now, in terms of the federal mental health system, unfortunately, we don't have a great one. We're very fortunate in California for as many issues as we have with the mental health system, and there are many, as there are in a lot of systems. We're actually considered a model for a lot of other states. So we're going to keep pushing the envelope as advocates, right? We're going to keep saying, okay, and here's how else we can make it better, and we can do this too, and be models for those other states to also implement some of these policies. So at the federal level, most of what's happening in mental health, if not all that happens at mental health, is really through the Substance Abuse and Mental Health Services Administration. They do also have open meetings that you can join by web. They're really more informational. They're not a great platform for advocacy, has been my experience. However, they do have committees. So if you're really interested in impacting mental health policy on a federal level, I would encourage you to take a look at what their committees look like, their advisory committees, and if you have the capacity to join one of those committees. Now, in order for any state to get money from SAMHSA, they have to have a behavioral health planning council body. And we in California also have a behavioral health planning council. They meet quarterly. They are also open to the public. The Behavioral Health Planning Council oversees any funds that are allocated to the counties, and counties do have to apply for those funds. And you can check on your behavioral health website for your county to find out if they have a SAMHSA block grant that they're using. And if they do, then they're over that money is overseen by the Behavioral Health Planning Council. The Behavioral Health Planning Council, also a really great place to advocate. They are also open to the public and offer opportunity for public comment and public input. They are also incredibly responsive. Please don't be dissuaded by their website. Their website is not easy to use. I will say, though, that their staff members are very responsive and very supportive. And if you're identifying issues in your county, they're really great resources. Even if it's not through the SAMHSA program, if you contact them and they say, oh gosh, that's not something that we oversee, they might be able to direct you to who does have decision-making power on that. On the federal level as well, Medicaid provides the matching dollars for our Medi-Cal. Medi-Cal is just California's fancy way of renaming Medicaid so that it has our state in it. The federal government also provides additional funding for Medicaid and Medicare waivers. That's when a state applies for a particular funding or a particular program that they want to see Medicare funding for, Medicaid funding for. In California, we have something called whole person care. Not every county has it. If your county has whole person care, that's something that's through funding through the federal government. Also a really good way to talk to folks in your county who are overseeing that and saying, are we really addressing the whole person? Because if we want to address the whole person, we need to talk about how race and experiences of racism and institutional violence have impacted our communities. And we need to talk about how folks in the queer and trans community are being supported or actively rejected from their community. So that's a part of being a whole person. And then the federal government provides the SAMHSA block grant. So you can go ahead and do the next slide, please. Okay, so where can you engage in the mental health planning process? We've talked about that a little bit throughout. I do actually want to take just a moment to clarify that this is very systems heavy. I do think it's important for us as marginalized communities to understand how systems work. And I also want to clarify that this doesn't mean that we as advocates support the way the system works. I think that all of us probably have an understanding of ways in which institutionalized systems, the way the public mental health system has harmed our communities just by how it's set up and how it functions, how it's excluded us in many ways. And I also think it's important that we understand that system so that we can get in and make changes to the system. In particular, in the queer and trans community, we do a lot of systems education as a part of our project because for so long, queer and trans people were actively excluded from the system. We were told we didn't have a place, that we could not only not receive care, but we could also not be service providers. We certainly couldn't be leaders or decision makers. And so our community learned how to do it other ways. We learned how to do individual fundraising. We learned how to do peer support groups. We learned how to run services out of people's garages, much in the same way communities of color have also needed to do that and find other homes for our services, other homes and other ways of supporting our community that felt more affirming and felt more loving to our identities. And as a result, now that we live in a system that's starting to talk about how can we include these people, and now that we have a system that has policies in place that require the inclusion of our communities, oftentimes, at least for the queer and trans community, we want to do that. We want that funding. We want those policies. We want those programs in place. And we don't know where those decisions are being made. So I want to make sure that we in our communities know where those decisions are being made so that we can be in the rooms. We want to be in the rooms where those decisions are happening so that we can be a part of the conversation and a part of leading the process. So at the county level, that happens at the MHSA steering committee, the mental health board or your behavioral health board, the alcohol and drug advisory board, the school district boards, and the board of supervisors. So those are places that you can go in your community. They are open to the public meetings. They require that they allow public comment. One of the handouts that will be attached to this webinar is how to make public comment. So if you are new to public comment and you're bringing folks from your community to these meetings with you, if they're new to public comment, they have kind of an idea of what that can look like, how to phrase those comments, and stay to the point, because oftentimes there's a limit to how much public comment you can make at any given meeting. Public entities are required to post at least 10 days in advance when the meeting is, where the meeting is, how to access the meeting, and to be accessible to all communities. If you're somebody who has a disability, if you're somebody who speaks a different language, that's when you can send in an email or a phone call to that particular body and say, hey, we're coming to this meeting and we need interpreters, or we're coming to this meeting and we need to make sure that we can access the building without needing to do stairs. Anything that you need to do to make it accessible, it's one of the reasons why they're required 10 days in advance. Also, so that they're not making decisions without the public being informed that those decisions are being made, because we live in a democratic country where you get to be a part of that decision-making process. I would also really suggest, particularly when it is a part of mental health, that you bring folks with lived experience. That can be lived experience as a service provider to folks experiencing mental illness. That can be lived experience as a family member of somebody experiencing mental illness. That can be as somebody who has a mental health diagnosis yourself, somebody who's actively managing their mental health now. Those folks that are most impacted by mental health services and how our public mental health system works are folks that we need to get at the mic. Those are the folks that we need to be hearing from and making decisions. And because of the way our public mental health system is organized, particularly because of the cultural competence requirements of the MHSA, they're required to center consumers. And consumers is just the government way of saying folks who engage in the public mental health system are considered consumers. So that's really important. If you're both, share that. When I go to meetings at the county or the state level, I let them know, hey, yeah, I have a master's in social work, and yeah, I do this for a living. And I also let them know, and I have lived experiencing managing a mental illness. Because it's really important that they see that folks who live with mental illness, folks who are managing their mental health actively, that we're in the community, that we're leading the community, that we have the ability to make decisions for our own well-being, that we know our communities best, and that for many of you who maybe are engaged in other types of social work, that nothing about us without us, right? Don't make decisions about me without me in the room, right? I get to make decisions that impact me. Your communities get to make decisions that impact them. And it's really important to remind these advisory boards. And I would also like to encourage you that I know for me, I oftentimes feel very frustrated and angry at the way systems and people within systems treat my community. And I have to remind myself that I'm actually not going to be successful if I walk in with that anger, that I need to set it aside long enough to talk to these folks and let them know, hey, I know that you want to do better. Let me offer you a solution. Because oftentimes folks who are on these boards, it's not that they don't want to support our communities. Sometimes they just don't know how. Or sometimes they don't even know that they're not supporting our communities. They thought they were supporting our communities, right? And it's not until we go in the room and we say, hey, wait, this is happening, and we offer a solution to them, that things change. And I have to say, my experience has been when I offer a solution rather than just tell them what the problem is, that they're actually pretty receptive to that solution if they're able to do it. And also crowdsource your solutions. Don't walk into these meetings as the sole representative or with only your experience, because your experience is your experience, right? And we all experience different intersecting identities around our ability, our income level, our diagnosis, our race, our sexual orientation or gender identity. And so we can't represent an entire community, but what we can do is say, hey, I'm involved in advocacy at this level. Can you tell me what you'd like to see happen so that I can make sure I'm bringing that to the conversation too? I would also recommend the same thing if you go to the state meetings. So if you're going to the Mental Health Services Oversight and Accountability Commission, yes, go in with your story. Also go in with the stories of the folks that you love and the folks that are in your community and say, hey, this is how it's impacting folks that I love in a really real way. They're more likely to listen to that if you can say, this isn't an opinion, this is real life, this is what it looks like. I would definitely, if you're going to go on the state level, I would certainly recommend the MHS-OAC and the Behavioral Health Planning Council. Again, with the Department of Healthcare Services stakeholder engagement, which they do have, I want to say monthly, a stakeholder engagement meeting. Those meetings are more informative than they are engaging the general community. If you're going to want to engage in advocacy with them, I would suggest pulling in a state partner to help you with that. And then elected representatives. And I know for some of you might live in conservative counties where that's not an option. Your elected representative is not an option. Some of you live in counties where your elected representatives are options. And I would encourage you to go to those folks if you're able. All of our elected representatives, if you just Google, like, who's my state representative, it'll pull up, it'll let you put in your address and zip code. They all have in-district offices. You might not be able to meet with that particular representative, but you can meet with their staff person. And staff people for our reps are so helpful. They will talk to you, and if it's something that they can help you with, they'll help you. If it's something that's a systems issue, they'll bring it to the representative and say, hey, representative, this is an issue that's happening in our district. Are there some legislative fixes that we can do? So I would highly recommend that you engage at that level as well. And then, again, on the federal level for the Substance Abuse and Mental Health Services Administration, the meetings that are available are more informational than engaging. So take a look at the committees and also talk to your elected representatives. Again, we're very fortunate in California. We have representatives that are very supportive of our communities. And if you're able to travel to where their offices are, I would suggest that you do that. I also, and I don't have it in the slide, you can actually go to the next slide if you want. If you would like to engage in advocacy too, and you're feeling a little overwhelmed, or you're feeling like, yeah, this is really great information, but I don't know how much capacity I have to do that, or what happens when I reach a place where I don't know what to do? Well, that's why we have things like the Behavioral Health Equity Collaborative. That's why we have the Out for Mental Health Project task forces. So I would encourage you to find out what type of coalitions already exist in your region or at the state level that you can plug in at. I think we probably all as community members know that when we're working together, we have a bigger impact, because what I'm good at is going to be different than what somebody else is good at. What I know is going to be different than what somebody else knows. And so if we can bring as many people as possible to the table with a lot of different expertise and a lot of different capacities and energy levels and communication styles, that's when we're most successful. So if you're feeling overwhelmed, just know you're not in it alone, right? CPEN is there. CPEN is available to provide support and technical assistance when it comes to POC mental health. And the Out for Mental Health project is here and available if it has to do with LGBTQ and queer issues. And we're always happy to work together if it has to do with all of those things, right? Because none of us is any one thing. So when it comes to creating change, this is what I suggest in terms of questions you ask yourself is, what is one thing that you would like to see changed? And be very specific. So instead of saying, I wish that therapists were, or I wish that there were more therapists of color available in my region. I wish there was more mental health workers, or maybe if therapist isn't right, maybe if actually what you need is not therapists, maybe what you need is community elders or mentors to provide services, to say, gosh, I wish that there was more elders in our community that could provide mental health services. That's kind of vague, right? It's great and it's a really good goal, but you want to be really specific. So what I want is our county or a board of supervisors or a drug and alcohol board, whoever it is, I want our county to fund mental health first aid to community elders and pay them for their services within a prevention and early intervention funding umbrella, right? So be really specific. And if you're not sure, if you don't know the system well enough to be that specific, again, check in with somebody who knows the system a little bit better for some mentorship, for some technical assistance and guidance. But you want to be really specific. And then once you know what that thing is that you want to see changed, and the reason I say pick one thing is I know for me it feels really overwhelming when I start thinking about all of the things that are wrong with our system and that need to be changed. And so for me, it's a way to not get overwhelmed. I say, okay, well, what's the one thing I can do right now? Okay? And then the next thing is, who has the decision-making power to make this change? Is this something that only the behavioral health director can authorize? Is this something that your mental health services committee can recommend? Is this something that your faith leaders or community leaders need to do? Is this something that your community centers could provide to the county, right? Is this something that you have a cultural competence committee in your county that you could talk to about? Who can make that decision, right? Because that's who you want to talk to. And if you don't have a direct line to that decision-making person, then you go, okay, so ultimately our behavioral health director needs to make this decision, but I don't have direct access to my mental health director. So you know what, actually, I think what I'm going to do is I'm going to see if I can get the mental health board to make that recommendation. But the mental health board only takes recommendations from their regional committees. Okay, well, that's where I need to start then. I need to show up at those regional committee meetings every month and tell them I want to see this change, okay? So that's where I'm going to start advocating first, because now you know who ultimately has the decision to make the power, and you understand what the path is to that person, okay? So that's where you want to start your advocating, is with those folks, and then work your way up that line. And then the other thing is provide specific recommendations for change. And don't just say what the problem is, say what you want. What's your solution to that problem? Even if it's a fantastical solution, I guarantee you that if it's a fantastical, unmanageable solution, someone will help you figure out where you can start with that at least, okay? And then go ahead and go to the last slide. So you do have handouts that are attached to this webinar. One will let you know how to access your particular county's mental health boards and commissions. Some counties are super easy to access and find. Some counties are not. So we've provided the links for you. There's a handout on how to make public comment, and there's a handout on the Out for Mental Health Project and our fact sheet. You can also go to the website that's on that fact sheet, and we have other types of handouts like the school to prison pipeline, how to get an affirming therapist, lots of other types of materials that you can request, and we're happy to send to you. And go ahead and move forward on the slide. And if you have any questions, comments, confusions, want technical assistance, please definitely reach out to me. I'm more than happy to help you. If I can't help you, because I definitely don't know everything, I could probably find out who can help you. Thanks, Carolina. I'm going to pass it over to you now.
Great. Thank you, Mandy. And we have a few questions lined up from folks on the line. So let's spend a couple more minutes looking through those questions. So the first question here is, Mandy, how do the new propositions that use funding for homelessness affect this work?
That is such a great question. So I'm assuming you're talking about the No Place Like Home funding. What's interesting about the No Place Like Home funding is it was actually originally passed as a bill a couple years ago. And it was passed as a bill, and the system was set up. They established the councils, the Homeless Coordinating and Financing Council. They started setting up grants. They started coordinating with the Mental Health Services Oversight and Accountability Commission. And then someone said, actually, that's not legal. You can't decide to spend that much money, because they're reallocating that money from Mental Health Services Act, so from Prop 63 money. They're taking it away from that big pot of money that reallocates to counties, and they're moving it to housing for mental health specifically. So the community said, you can't do that without actually talking to us, right? Like, you can't decide to take this money and use it without letting us know or vote on it. So it was put on the ballot. This process is actually already a couple of years in. So if you look up the No Place Like Home initiative, the Homelessness Financing and Coordinating Committee, you can find more information about where they're at in this process. But even though the proposition just passed, they're actually already at the stage where they're accepting requests for proposals and grant applications. So definitely keep an eye on that. The other thing is it will impact mental health in that hopefully it will mean that our folks with mental illness that are on the street are going to get the support that they need. One thing that this proposition did ensure is a mental health best practice model of housing first. So anybody who's getting No Place Like Home funding cannot put requirements on their residents that they have to do particular activities, that they have to engage in particular services in order to get housing. They have to provide housing first, housing as the priority, and offer all of those mental health services, which then the consumer, the client, the resident can choose to engage in, because we know that's actually a best practice. So the Homelessness Coordinating and Financing Council is really committed to that. They're really committed to that model. I will also say everybody who's on that council is a department leader. So they're department directors. There's only, I want to say, one actual consumer or one person who has actual lived experience as somebody who was homeless with a mental illness on the commission. Most of the decisions are being made by department directors who are really well-meaning and really lovely people and don't have lived experience. So if you're able to show up and be in those rooms for the meetings, if you're able to send letters to the council, I highly recommend that you do that. They need to know what our communities need in terms of that. But overall, I would say that it's pretty exciting because the majority of folks who are homeless are experiencing mental health. Either they're homeless because of their mental health, or they have mental health issues because of the trauma of being homeless. Is pretty scary. So it impacts it in that way. And if you have any other questions on that, feel free to email me for follow-up.
Thanks, Mandy. And then one more question that we had from someone on the call is, can you repeat the name of the programs or coalitions that people can get involved in? And then the second question they asked is, will public charge affect people experiencing mental health issues?
Thank you. So the coalitions are the Behavioral Health Equity Collaborative, and that's something that CPEN coordinates, and that's a statewide collaborative focused on POC behavioral health issues. And then the other one is the Out for Mental Health Task Forces. So our project, Out for Mental Health, has task forces in all 5 what's considered mental health regions in the state. And so one is in Shasta County, one is in Sonoma County, one is in Los Angeles County, one is in San Luis Obispo, and one is in Fresno. You are welcome to join whichever one is closest to you. If you don't identify as a queer or trans person, that's okay. The information is absolutely applicable and can be used in other contexts. Also a good way to build community and collaboration. So if you are an ally or you're working at those intersections, right, because POC are queer and trans too, please feel free to join that. And you can learn more about that by emailing me or on our website. And then in terms of public charge, we definitely have concerns about public charge, well, for all of the reasons you already know, and specific to mental health, because oftentimes folks with mental health issues are, particularly those experiencing trauma, we're really concerned for queer and trans folks who are immigrating because where they live now is hostile to their sexual orientation and gender identity. And what's also true about that is oftentimes those folks aren't able to be open about that, and so they're not considered asylum seekers or refugees because they're not outing themselves when they're trying to immigrate. So they often need things like mental health care, or oftentimes are unable to work for a certain period and qualify for things like Medi-Cal because of the trauma they've experienced related to their sexual orientation and gender identity. And so we're very concerned because the changes that are being proposed to the public charge rule would include Medi-Cal within the services that are considered part of the public realm or public services that would be tracked for the purposes of immigration. And we want people to be able to access Medi-Cal. We want people to be able to get mental health services, and we don't want them to have to out themselves to do it. And in order to receive, to come in as a refugee and not be subject to the public charge rule, they would have to out themselves as immigrating because of their orientation or gender identity. And people shouldn't have to out themselves to receive services.
Awesome. Thank you so much. I don't want to cut the conversation. If you have any additional follow-up questions, folks have lots and lots of questions, please don't hesitate to reach out to Mandy or myself. And actually, that's a great transition to our last slide. If you could please next. This is just a reminder that please submit your public charge comments if you have not already done so. We have until December 10th to tell the government why this rule is a bad idea. For folks that are less familiar, the proposal expands the types of benefits that could be considered in a public charge determination, and that includes Medi-Cal and the Medi-Cal's mental health benefits. So again, please submit your public charge comments. Make sure your comments are submitted before December 10th, and you'll see on this slide that the best way to comment is to go online. And we will be sending out these slides as well as the recording, and post that on our website and send it out to all the attendees as well. If you have any other questions, please reach out to CPEN, myself, or Mandy. Thank you all so much. Thank you, thank you, thank you.
Thank you, everyone.